CIET NCERT presents the audiobook of Physical Education and Well-being titled Khel Praveen for Grade 9.
Chapter 16 Women in Sports. Page number 122. In the history of India, warriors like Rani Lakshmi Bai, Jhalkari Bai, and Devi Ahilya Bai demonstrated courage and physical prowess as they fought to protect the country and uphold their ideals. Women's participation in sports has increased gradually, and female athletes continue to break records, challenge stereotypes, and inspire future generations. Over the years, India has seen a huge rise in women's sports participation. Government programs such as Khelo India and the National Sports Talent Search Scheme aim to encourage and support women athletes across the country. Figure 16.1 illustrates the drawing of a female athlete running on a racing track. It says benefits of exercises in women. Various benefits have been pinpointed in the drawing. These are improved sleep, improved bone density, weight management, reduced risk of diabetes, decreased blood pressure, decreased cholesterol. Gender equality and progress in sports. The Constitution of India ensures gender equality and works to eliminate any form of discrimination, including in sports. Despite this progress, women still face challenges like unequal pay, less media coverage, and limited representation in sports administration and leadership roles. Page number 123. However, India has achieved a significant milestone in this area. Both the Indian Olympic Association and the Indian Paralympic Committee are currently led by women. To address this at a global level, the International Olympic Committee (IOC) has been actively working to promote equal participation of women in sports and related fields. In fact, the next Olympic Games are expected to have around 49% women participants, marking a major step toward equality. Physical benefits of sports for women. Regular participation in sports and physical activity provides numerous health benefits for women, including prevention of lifestyle diseases. Regular physical activity reduces the risk of diabetes, high blood pressure, and obesity, helping women maintain good health throughout life. Stronger bones and muscles. Women are more likely to suffer from osteoporosis or weak bones than men. Sports and exercise help increase bone density and keep the skeleton strong. Improved muscle tone. Regular training and sports participation strengthen muscles, improve flexibility, and help maintain proper posture. Better heart and lung health. Exercise improves blood circulation and oxygen supply to muscles. It strengthens the heart and allows women to perform physical activities for longer without fatigue. Weight control. Obesity is a major health concern, and women are more likely to be affected than men. Active participation in sports helps maintain a healthy weight and body shape. Page number 124. Psychological benefits of sports for women. Sports have a strong impact on mental and emotional well-being. They help women become more confident, focused, and positive in life. Stress management. Physical activity releases hormones like endorphins that reduce stress and improve mood. Active women handle pressure and emotional challenges better. Emotional control. Through training and competition, women learn how to stay calm and composed under pressure, improving their emotional balance. Confidence and self-esteem. Winning, improving performance, or even participating builds self-belief. Every achievement, big or small, boosts self-esteem and inspires women to aim higher. Leadership skills. Sports teach leadership by encouraging teamwork, responsibility, and decision-making, skills that help women succeed both on and off the field. Social benefits of sports for women. Sports not only improve health and confidence but also strengthen social relationships and community bonds. Communication. Sports encourage players to express themselves clearly and communicate with teammates and coaches, improving social and verbal skills. Teamwork and cooperation. Women learn to work together, respect others, and cooperate to achieve common goals. Important qualities for both sports and life. Coordination and relationships. Team sports improve coordination and teach how to build healthy relationships with teammates, officials, and the community. Page number 125. Social inclusion. Sports bring women from different backgrounds together, promoting equality, understanding, and mutual respect. Special considerations in women's sports. While we work to encourage more women to participate in sports, it's also important to understand the unique physiological aspects of female health that can affect athletic performance and participation. Menarche, the beginning of a menstrual cycle. Adolescence is a stage of life marked by rapid physical and biological changes that lead to sexual maturity. For girls, one of the most important phases of this stage is menarche, or the first menstrual period. Menarche usually occurs between the ages of 8 and 15 years, though this can vary for every individual. It marks the time when a girl's body becomes capable of reproduction. This process is a natural part of growth and is linked with the development of secondary sexual characteristics such as breast growth and widening of pelvic girdle. Many factors can affect the timing of menarche, including genetics, family history, nutrition and health, physical activity and body weight, and socio-economic and environmental conditions. Activity. Let us plan a talk show in which our classmates will discuss how our schools should encourage girls to participate in sports and games. Let us organize an awareness program in our neighborhood to highlight the benefits of sports for women. Talk to our parents after dinner time about how our family has supported their daughters in pursuing athletic goals. Let's prepare a poster of those sports which are offering equal prize money to the winners regardless of gender, mention the amount, and display it in an appropriate place. Page number 126. Understanding menstruation. Menstruation, often called a period, is the monthly shedding of the uterine lining through the vagina. Periods typically last 3 to 7 days, though more commonly 3 to 5 days. A normal menstrual cycle occurs every 21 to 35 days. Women typically have periods until the age of 45 to 55 years, after which they experience menopause, meaning the natural end of menstruation and fertility. Menstrual health is an important part of overall well being. Regular cycles are a sign of a healthy reproductive system. Menstrual dysfunction. Sometimes women and young girls experience irregularities or problems in their menstrual cycle. These are called menstrual dysfunctions. A normal menstrual cycle happens once every 21 to 35 days. If it occurs more often, less often, or causes extreme pain or bleeding, it may indicate a problem. Common causes: overweight or underweight, stress and anxiety, poor diet or eating disorders, sudden changes in physical activity or training schedules, hormonal imbalance or certain illnesses. Types of menstrual disorders: premenstrual syndrome, PMS, emotional and physical symptoms before periods such as mood swings, headaches, tiredness, and irritability. Can be managed through exercise, healthy diet, and enough rest. Page number 127. Amenorrhea. Primary amenorrhea, when menstruation does not start by puberty. Secondary amenorrhea, when a woman misses her periods for 3 months or more after they have started. Dysmenorrhea, painful periods with cramps, backache, or fatigue. Menorrhagia, very heavy or prolonged bleeding during periods. Polymenorrhea, periods occurring too frequently, less than 21 days apart. Oligomenorrhea, infrequent periods more than 35 days apart. Metrorrhagia, metrorrhagia, irregular bleeding between periods. Postmenopausal bleeding, bleeding that happens after menopause, after a woman has stopped menstruating. The female athlete triad. While sports bring many health benefits for girls and women, some athletes face health issues due to imbalanced diet and training. One such condition is called the female athlete triad, first described by the American College of Sports Medicine, ACSM, in 1992. The triad includes three interrelated conditions. 1. Low energy availability, with or without eating disorder. 2. Menstrual dysfunction, absence or irregularity of periods. 3. Low bone mineral density, weak bones. These three are connected and often occur together in athletes who train intensely but don't eat enough to meet their body's energy needs. Page number 128. Low energy availability. This happens when athletes do not eat enough food to balance the energy they spend during exercise. It may occur due to dieting, fear of weight gain, or eating disorders such as anorexia nervosa, an extreme fear of gaining weight, leading to eating very little or over-exercising. Bulimia nervosa, eating large amounts of food and then using unhealthy methods to remove calories such as vomiting or using laxatives. Common symptoms include fatigue, weight loss, stress fractures, irregular periods, anxiety, and weakness. Proper nutrition and professional guidance can prevent or correct this condition. Low bone mineral density, BMD. Bone health depends on proper nutrition, hormones, and exercise. When women have low estrogen levels or poor diet, bones become fragile and weak, a condition known as osteoporosis. This can cause stress fractures, pain, or deformity later in life. Bone growth and strengthening happen mainly during childhood and adolescence, so maintaining proper diet and physical activity during these years is vital. Sports are not just about winning medals or breaking records. For women, they represent freedom, empowerment, and the opportunity to challenge stereotypes. Every girl who picks up a cricket bat, laces up running shoes, or steps onto a basketball court is making a statement about her capabilities and her right to participate fully in society. Myths and taboos. A common myth is that girls should not exercise during their period. But in truth, light exercise often helps reduce cramps and improve mood. Even Olympic champions compete during menstruation. What matters is comfort, hygiene, and listening to your own body. Page number 129. As we grow, remember, body changes, emotions, and thoughts during adolescence are all natural. Respect traditions, but also question and understand them scientifically. Knowledge is what helps you grow confidently. Figure 16.2 has been given on this page. It shows a graph where on the x-axis age in years has been mentioned from 0 to 100. On the y-axis, the bone mass, total mass of skeletal calcium in grams has been mentioned from 0 to 150, 500 till 1500. It shows two graphs, one in blue showing the male graph and the one in red showing the female graph. The graph is about bone growth. It says peak bone mass in males is by the age of 30, 40 till 50. The decreasing bone mass with age starts at 50 and goes on till 60, 70 and forward. In females, the peak bone growth happens at the ages of 20, 30 till 40, and bone loss due to menopause starts from the age of 60 years. Chapter 16, Women in Sports, ends here.
Khel Praveen, You were just listening to this audiobook, Textbook of Physical Education and Well-Being for Grade 9. Narrator Vaibhav J. Srivastav. Sound recordist Muhammad Faizan. Assistance in production Mukul Singh. Directed and produced by Vimlesh Chaudhary. This audiobook is brought to you by CIET NCERT, New Delhi, India.